Welcome to Pediatric Pioneers, a MedBridge podcast where we conquer challenging topics for the pediatric therapist through conversations with pioneers who have blazed new trails in our practice. Our aim is to deliver actionable takeaways for practitioners like you. To receive continuing education credit for this episode and access bonus resources, be sure to check out medbridge.com. Hello, I'm your host, Nicole Quint, and I'm an occupational therapist with over 20 years of experience in practice and academia, specializing in pediatric practice and the improvement of occupational participation and performance through my expertise on executive function, visual perception, social emotional learning, sleep, and sensory processing. It is my passion to support pediatric therapists like you so that you can best serve the families under your care with evidence-based practice solutions, easy to implement advocacy approaches, and new ways to lean into your skills within the challenging pediatric landscape. Hi, everybody. Welcome. Today, I'm excited to be joined by Dr. Jacque Sample. She is not only a doctor of occupational therapy, but she's also a fellow of FAOTA. She's an expert in the area of OT advocacy and school-based practice. And we are going to be diving deeper into this topic, including recent research and actionable takeaways that you can all implement right away. So welcome, Jacque.
Thank you. I'm glad to be here.
So we're really excited to have you on this live edition of Pediatric Pioneers tonight and excited to have everyone joining us. So why don't you get us started with telling us a little bit more about yourself and how you became involved with OT advocacy in school-based practice?
Sure. So my name is Jacque Sample. I live in Columbia, Missouri. It's very hot here right now. I've been an occupational therapist for 26, 27 years. I stopped counting after a little while. I pretty much specialized in pediatrics and school-based practice. I honestly got into advocacy for school-based practice first as a mother. My oldest son has autism, and everybody will meet him a little bit later, which he's excited about. So my advocacy started there as a parent, and eventually I ended up working as an occupational therapist in the schools, and then got to see that backside of things and what was working and what wasn't working. And so I started working on what isn't working, and that led me to all kinds of projects. I tended to collect projects along the way. So yeah, that's where I'm at.
And so what have you been doing lately as an advocate? What are some of the roles that you have and some of the, projects that you said you gathered that you've been working on in this realm?
Right. So informally, parents reach out to me, usually through Facebook all the time, because they hear about how I've assisted other families. And so I will guide them through different meeting processes or IEP questions, those kinds of things. That's really informally. More formally, my advocacy work has allowed me to meet some of our elected persons in the state of Missouri, and that's developed into some really beautiful partnerships. And so I was able to utilize those relationships in order to initiate a process to rewrite the Missouri state guidelines for occupational therapy practice in public schools. So started with a meeting, a 2-page handout to the people in charge, and developed into me finding team members and building a team and rewriting the guidelines. And they've been written for a year. State processes are always very slow. So even though they've been written for a year, they're not yet published. So we're still kind of waiting for them to be published. But it was a fun process to build a team and bring everybody together and rewrite a very outdated document. So that's been the biggest advocacy project lately.
Okay. And I think that kind of shows that one person can make a difference, right? Mm-hmm. Take that leadership and put it into action. So I'm really excited to hear what advice you have for everybody based on your own experience and advocacy. So let's just dive right into it, right? We're in a state of change, I guess is the word I'm going to put out there. What is the current situation with respect to the Federal Department of Education and the changes that are being made? And I guess while you're answering that, thinking about what do we need to know about this department to fully understand why this is a pivotal time for public education, for special education, and obviously occupational therapy's role within that?
Okay, so lots of questions, and I kind of just want to go because you look at the news pretty much every day, there's a little bit of tidbit of things changing, and there were changes even just like a month ago that altered the information that I was going to talk about tonight. But I think, as you mentioned, first it's important for us to back up a little bit and have an understanding of what the Federal Department of Education has historically done for us. And their main functions have always been, setting those national standards or national requirements for what special education is supposed to be, providing the funding. So the funding, this is an interesting part. So like when IDEA was passed, Congress said, hey, school districts, we know you're strapped for cash. So we are going to reimburse you 40% for each student who requires special education services or is eligible for special education services. But they've never quite reached that level of funding. Depending on where you look, the percentage of reimbursement or funding that they've provided to schools is between 12 and 18%. So well below their promised 40% reimbursement or funding for schools. So but still, it's a little bit of something that helps. Not great, not as much as they promised, but it is a little bit of funding. They also ensure compliance and accountability. So they make sure that states are following the requirements for special education. They're checking all the boxes. We're doing what we need to be doing. They also protect the civil rights of the students. So if the student is not receiving services as they should be, that's a violation of their civil rights. That would go through the Federal Department of Education to respond to act on those kinds of things. And then finally, one of their functions is to collect data and inform us, what is working, what is not working, what do we need to do to improve the outcomes of the students who receive special education services, those kinds of things. So that's the overarching function of the Department of Education as it was. Some acronyms that everybody needs to be aware of, because healthcare and education, right? We all have acronyms for whatever reason. The first is OSEP, and that's OSEP. That's the Office of Special Education Programs. And then OCR, Officer of Civil Rights, and OSER, OSER, which is the Office of Special Education and Rehabilitative Services. So that's a mouthful. So it's OSEP, OCR, and OSER. So as we know, related services, OTPT and speech, we all fall under the umbrella of IDEA and the Federal Department of Education and those services. And so anytime there's a change at the federal level, it's going to impact what we do on a day-to-day basis in schools. So it's important for us to be aware of what's happening. So first of all, last fall, there were some significant employee cuts in some education departments, specifically OSER. And what that meant is there were less, and OCR, there were less people to follow up on concerns or to monitor that states were doing things correctly, all of those kinds of things. In fact, one of the resources I found when preparing for tonight was, so OCR, the Office of Civil Rights, like as of September last year, had cleared 90% of their civil rights complaints by just closing the cases. So they weren't actually addressed. So that's what we're looking at when we're looking at those deep cuts in staff. And that's concerning because we want our students to have their free and appropriate public education in the least restrictive environment. And if that's not happening, the civil rights complaint are filed, that's a problem. And I think, just the overarching problem is nobody knows what's happening. There doesn't seem to be a plan. If there is a plan, it's not being clearly shared necessarily with us. And so that always makes people feel uneasy. And I know for me, as a practitioner who cares deeply about the students I work with, I kind of would like to have a plan in place before these major things happen. So it feels things are just kind of on edge. And then fast forwarding, and we talked about last fall. So just last month, like 4 weeks ago, it was announced that I might be jumping ahead here, our Office of Civil Rights was going to be moved to the Department of Justice, who oversees laws and, bigger things, like the legal side of things. And then our rehabilitative services and special education programs were moving to Health and Human Services. Now, Health and Human Services oversees Medicare and Medicaid and the National Institute of Health and the CDC. So very medical lens, symptomatic, what's happening medically. And now we're piling education into that. And that can be really confusing. I mean, I spend lots of time, I'll speak for myself, lots of time talking to administrators and teachers and parents on the difference between medical-based occupational therapy and school-based occupational therapy. Well, now what's happening is they've grouped that educational piece in the Health and Human Services. And I'm sure it's going to result in confusion when you have these great big things that they're already in charge of. I'm worried about that being kind of pushed to the side because it's a less population. And in addition, when you have the civil rights over here, and then you have the special education programs and related services over here, there's not that clear communication for civil rights infractions, for implementation of education programs. It's like adding a step because there's this big cliff between the two. So that's a very quick version of kind of what's happened over the last few months.
But I really appreciate you going over the acronyms. Yes, everybody loves acronyms. I'm not sure if education loves them more than healthcare. It's a tight race. But yes, so we have all these acronyms. And, when you go you were talking about the data that's collected. There's all sorts of data on all the special education, everything. You can find it. And it's usually related to OSERS or OCR. These offices put them out there. And now kind of appreciating that they're going to be separated is rather an interesting plan, and I think it's important to go over that. So obviously you're saying to us that we don't have a clear picture of what's ahead if it's still not fully been released. So if we don't know this, why don't we start our conversation with what we do know? Let's ground it in what we know at this time, which I think you kind of alluded to could change. It changed in the month that you've been preparing for this. So what does the research tell us about outcomes for students when OT is fully embedded in the school system? What are the highlights we should be paying attention to right now? Because I think it's important that we know what the benefits of occupational therapy are, for our kids that we see in school-based practice as we move toward uncertain times, right? And grounding it in that research.
Well, I think the most important piece that's presented in evidence over and over again is the importance of really focusing on the occupation of the student and the participation of the student in natural educational contexts. There has been kind of a historical practice that administrators maybe expected of occupational therapy practitioners having a closet or a table in the hallway and doing handwriting. And that's just become an expected routine. When the evidence is telling us, no, we need to be in the natural educational context and working with the student as much as we can in their classrooms, in art class, in the lunchroom, whatever it is, so then we don't have to worry about the generalization of skills happening because that doesn't always happen very easily with the students that we work with. And I say that to saying and recognizing that there are some students who do really require some one-to-one, specific task attention. And there's nothing wrong with that, but we should really be pushing more towards, if they still need that one-to-one, we should be trying to add in some either additional or instead of only pulling them out, adding some more push in. I don't really like that term, but natural educational context.
Integration. Yes.
Thank you. Services, so we're not pulling them out away from peers and their natural learning environment. So that's really important. And that leads into other, research and actual activity and activism that's happening across the country, which is recognizing our skills as occupational therapy practitioners and the fact that we are more than qualified to be leaders in the world of education, whether that is, directors of a related services program, supervisor of all the therapists, even director of special education. I mean, it depends on the size of the district, really. And a lot of districts have been, no, you can't do that. You're not a certified educator, so you can't serve in that role. Well, what we're being able to prove through our education is actually we're more than qualified. And so there are many states who are working towards trying to figure out that credentialing pathway so that we can plug occupational therapy practitioners into already established educational leadership roles. And then in that way, we have the OT lens leading related services or other OT practitioners or whatever that looks like towards best practice and out of the closets. So that's an important movement that's happening right now. Another one is a multi-tiered systems of support, or MTSS, which is part of ESSA, Every Student Succeeds Act, and the importance of embracing, or not really embracing, becoming involved in what that framework looks like. I know in Missouri, each district gets to decide what that looks like for their district. Mm-hmm. And so each district has a different name for their teams. You know, I've sat on a behavioral concerns committee, I've sat on student of concerns committee, I've sat on data committee. Everybody has a different name, and each district is deciding what that's going to look like for their district. So as OT practitioners, being involved in that MTSS early intervening, not early intervention, early intervening process is really important. So we can be there, again, general education setting, working with the team, identifying strategies, but this is going to involve inviting yourself to meetings. Example, I stayed after school one day finishing my documentation, and the principal came on and over the intercom and said, attention, the MTSS team will be meeting in the library in 5 minutes. And this is the first I'd heard of it. And I just kind of perked up. I finished my documentation and I walked down the hall into the library. It's like, I'm here. And you're not on the team. I'm like, well, can I be? And so it's just a matter of inviting yourself to the table sometimes and showing that you can see the whole student, the whole picture. We're looking at the student, we're looking at the environment, we're looking at what they're supposed to be doing and helping, and our behavioral brain too, right? And we're helping the team recognize the OT role that could be part of the MTSS. So that's a really big movement. And everybody needs to be part of that and figure out how to become part of that movement and building that framework, or if the framework's already set, integrating themselves into the framework so OT can be a really active part of MTSS building.
Mm-hmm. Yeah. And, it's interesting how you were talking about early intervening. And again, I'm going to say not early intervention, early intervening. I actually did my dissertation on school-based practice. And I was looking at invisible disabilities. And one of the things that I found was that it is really hard to get that initial referral, if you want to call it that, for the child that you see and have eyes on this kid. They fall through the cracks, right? When they have ADHD, autism, invisible disability, learning disability, as opposed to somebody a student who has a visible disability. So we know that early intervening is really important. And I would like to say that OTs are really good at seeing those children that could fall through the cracks and making sure that they get put into the process and have that, we're going to put for, have the screening, get an evaluation done. And so I think that I'm glad that you brought up the early intervening part, because I think that that's a really pivotal role for OTs that might not always be considered.
Right.
So I think it's
because
really
we're not considered in those decisions, because a lot of times, informally, occupational therapy practitioners are afterthoughts, or we're the handwriting people. And if there isn't a handwriting issue, or if they're kindergarten and they're not that worried about writing yet, we're not thought of. But I can speak pretty confidently for myself and maybe other people who are attending tonight or watching this later, that many times when we are in the classroom grabbing a student or doing natural context occupational therapy, we're looking around the room going, ooh, yeah, ooh, yeah, because we understand what the demands are and understand the reaction of the students to those demands. And so I think that's very common. And I just don't know that schools are always familiar with our ability to recognize those skills or those deficit areas or challenges or whatever you want to call it.
Right. And I think, yes, we see it, but we have to act upon it. We can't just keep it a secret and make sure that those kids get the services that they need. So, if we take all this information and this research seriously, it sounds like we don't just have a situation where we need to adapt to change. Obviously, there's a lot of changes going on. We have no idea. We don't have the plan. Like you said, it's not coming with enough time to get everything figured out and be comfortable, right? But we're flexible. We're OTs. We're very good at this. So it's about OTs actively advocating for a different kind of role. So I've heard over the years, and we always hear that nobody knows what we do. We're the best kept secret. It's we're working in the closet. They took our spot away that we were practicing before that wasn't great. Now we have a worse one, or they forgot to invite us to the meeting, or we can't have that role because we're not, credentialed for as an educator, or whatever it is, or we're relegated to being handwriting experts. So is this about OTs actively advocating for a new role? And what would it look like for us to rewrite our role as OTs in schools? And maybe not just OT, maybe some of our other related services friends are thinking about this too, rather than just reacting to whatever comes next. Maybe we could play a little offense.
Right. And I love this question because advocacy is what lights me up. But one of the challenges I would like to give all related services, but particularly the occupational therapy profession, because that's my profession, is to consider, is advocacy enough in this time and place? Or is it time for us to move to more activism, which is more intentional, more planned, more organized? I'm not saying picket signs and knocking down administrators' doors, but being really intentional and organized and pushing back. But one of those ways we can push back is we can embrace all of this really uncomfortable change that's happening. We can be worried about it. And that was my first response was, oh my gosh, pure panic. I can't believe this is happening. What does this mean? But then I said, what can I do about it? I'm not a congressperson. I'm not running for Congress. That's not in my plan. But because of all this change, what do we need in times of change? We need a team. We need people to bounce ideas off. We need people to help create what that may be. And so I think that we're in this really interesting position of all related service professions. This is the time that we need to raise our hands, that we may not knock down doors, but knock on doors and say, you need me at this table. When we are deciding or figuring out what the state is going to do in response to whatever happens at the federal level, you need me at this table because I can do this, this, and this. This is why. These are the outcomes. This is the science. This is the studies. This is how the students benefit from having related services in the school. And I need to be part of deciding how that's going to do because I know what I do better than you. And so that's the question, advocacy to activism. And it's an important question to consider, I think, as all of these changes are happening, but it's a great opportunity and we need to see it for what it is. This is an opportunity, even though we can be worried, this is an opportunity for related services to take the chance, take the initiative to say, I want to be part of the solution. I'm going to learn who I need to talk to. I'm going to sit at the table. Or if I find out who I need to talk to, but I don't really want to talk to them, I'm going to find somebody who does because I know that they are passionate and they speak about it better than I do. So I think it's important that we can be worried, that we see it as an opportunity and we fully embrace that opportunity and just go for it.
Mm-hmm. And I think, banding together, there's strength in numbers. There's, and everybody can have a role. Maybe someone speaks better than you, but maybe you could give them good notes
right.
to speak about, research. Right? You could do some research. What is your strength that you bring to the table? Because I'm sure you have a ton. So I love the whole idea of activism, right? Activism is action related. It's action oriented. And, it's like the doing part of OT. We talk about occupations and, being an advocate is a role, within right. OT, it's in our practice framework. Advocacy is something that we do within that role. But I feel like activism is a whole nother role, but it's more of an action related part of it where, if I'm going to be an activist, that's the role, but I'm going to be doing these action oriented occupations in my role as an OT in the school. To me, there's just so much more benefit to that than just advocating. And I think a lot of times we think of advocacy related to our patients or our clients or the students that you treat, but activism, this is now about our profession.
Correct.
And so it's a little bit different. This is for our livelihood. This is for our profession. This is for our identity. And I think it's a huge opportunity. And while it's not comfortable, great things come from uncomfortable opportunities, right?
Yeah, we're going to embrace the opportunity to stretch.
There you go. There you go.
Opportunity. We're going to stretch and grow and come out on the other end with new skills that we never know we had.
Right.
But yeah, that opportunity is just, I can't emphasize that enough. I don't want to see this. I would hate to see all of these changes at the federal level happening, and our profession or all related services profession not stepping in and taking the opportunity to be part of the change so we can help navigate and we can help make decisions that impact our professions and not just react and get upset and fight back against decisions that are made for us. So we need to make the changes, not let the changes happen to us.
So in that vein, what do school-based OTs, school-based PTs, school-based speech language pathologists, the OTAs, PTAs, the SLPAs need to consider when it comes to the perspectives of the other stakeholders, particularly those making the decisions, which are typically not related service practitioners? Are there some talking points, some word choices, some strategies that you would suggest to aid in buy-in and carry over for our activism?
Yeah. So this is where the, coming out of the closet is really important. Providing those services within the national educational context as much as possible. You can talk about what you provide to the students and how you assist the students and how you support the students. And you can present your data in IEP meetings and 504 reports. But for an educator to see you in action in the classroom, helping them navigate and learn different ways to support the student, their appreciation and understanding of our professions is going to be so much more rich. And so if we get to a point where the district is like, I don't think we need this related service, the teachers are going to raise up and say, wait a minute, because we have worked to develop our identity. We have shown how we can impact the classroom as a whole, how we can support individual students in the classroom, and how at the same time we're teaching the students the strategies or whatever is needed for that student to stay in the classroom and learn. And again, caveat, I know that scheduling is a nightmare and it's like Jenga and Tetris all in one, and trying to figure out how and when to see these students. And it's challenging, but it's also very, very rewarding to develop those stakeholder relationships, because then they're your allies. They're not just your team member, they're your allies, and they're cheering you on and they're supporting you as you're trying to make change that has the student at the center of your efforts. And so that's really important.
And we know OTs can do amazing things. I mean, we had Dr. Susan Basic on like 2 years ago talking about every moment counts. Mm-hmm. And, there's the OT piece is in every facet of the school day with that program. And that is now statewide in Ohio. Again, one person, do they have a team? Sure. But again, what we do is so important. And I think you bring up a great point. Once people know what we do, they want more of it. And teachers are definitely part of that group.
Yes.
So they will help advocate for us as well. Right?
Yeah, it's building those rapports. It's not just showing up the door, knocking and grabbing a student and leaving. And they're like, whoo, they're going to be, out of the classroom for 30 minutes. No, we're going to work together and figure this out. And so that every other day that I'm not here, every other 30-minute block that I'm not here becomes better because of the strategies we've implemented in the natural educational context. So It's super important.
Yeah. So, one of the questions before I get into the question and answer session really quickly, were there some word choices that you recommend that we use, or some specific ways that we go about that?
I think it depends on who you're talking with. So I think, and this is my experience, teachers, I think, do better with strategy words, where administrators want to know how much this is going to cost. How are you going to bill for it? Is it reimbursable? And so using those same kind of words, especially if we're talking about occupational therapy, specifically being part of MTSS, you can say, hey, outcomes, if I can do early intervening services, means later we may not have to do this because this is what the research says. So speaking in money is a common language because that's what we're talking about, right? Changes at the federal level is going to change things at the state level, which is going to change things at the district level. So talking money with administrators is always a good keyword and phrase, but that outcomes, data, equity, all of those kinds of things that they're already monitoring and that we're already doing. We just may not be using the same verbiage.
Yeah. I mean, you have to sell it from their perspective of what's important to them. So yeah, great points. Okay. So We have our question and answer part of the session now. So I'm going to see what questions we have for folks in the audience. Let's see here. Okay. So the first, so we have a question from Karen. Let's see here. And she's actually, I love when you're in the question and answer part and the person asking the question is being told it's an amazing question. So she's asking, she's curious to see how many therapists are contract-based providers versus employed by the district, especially in other states and regions. In Long Island, they are dominated by contract-based employment, primarily through contracted agencies that get contracts with the districts through public bidding processes. I feel this impacts ability to make any change because we are sometimes subcontractors of contractors. And that is what we have down here where I'm at in Broward County. So, yeah, that's a great question.
So I'm going to go back to a top we've already talked about is the importance of building those alliances with the educators. Because I've been a contractor and I've been a subcontractor before as well. And I've been a district employee. And the first job I had as a subcontractor, when I went into that school, I went in with the attitude of, I'm a subcontractor. No, I'm not going to get involved in this or do this because that's not my contract says. But then I built those relationships with the teachers, right? The special educators, and everything changed. And because it was about the students and it was also about supporting the educators. And it was a very natural, organic move to more of that, again, building that alliance to the point where I was able, again, where those educators were fighting for me to be part of planning and behavioral plans and whatever, because we had built such a strong team together. So it's, I say that knowing that some contractors have very specific contracts. So you do need to be aware of what's on that contract. But in my experience, I was still very much working within my subcontractor role, but still building those alliances. That can happen at the same time. And that's what's important.
Mm-hmm. Yeah. And I think this whole contract, subcontracting type of situation is becoming more and more common. Yeah. I think around here where I'm at in South Florida, I really only know of one district down here that still has OTs that work for the school or the district. Everybody else is working on, unless they, on contract, unless they have maybe like an evaluation team or they have a couple of people that do something special in the mix. Mm-hmm. And then I noticed the same thing for PT. What I do see that's different is a lot of times SLPs are still hired by the district or the school. So there is a little bit of a difference there. Is that something that you're seeing, or, when you're dealing with all these different school-based things that you've done in your advocacy work?
Yeah, I'm seeing that same pattern. And I think it's largely because the SLPs in Missouri, can be the case manager as well. And so the district will often hire them because then if you have a student who is eligible for speech and language, but they're not eligible for any kind of adapted curriculum like in math or reading, then the SLP can be in charge of that IEP, in charge of the plan, take all the data. And whereas in Missouri, occupational therapy and physical therapy cannot be the case lead. So that's in Missouri. I've definitely seen that pattern. And it's interesting because one of the schools I worked at where I was a subcontractor, when I left there, they said, what could we have done to keep you on? And I said, hire me directly through the district, because I wanted to have more of an impact on district policy. And as a subcontractor, that was hard. And a year and a half later, they started hiring direct occupants. So now they have one OTR and two OTAs as direct district hires. So I kind of, even though I wasn't there to see that happen, I kind of feel like I gave them a little kick in the pants to say, this would have been a lot better. And these are the reasons why. And it only took them a year and a half to 2 years to actually make that happen. So
that's quick for the school system, for a system to make change like that. Well, I guess that brings me to a question. I don't want to steal from the audience as they're putting their questions up, but that makes me think like, and this is feeding off of Karen's question, if we were to advocate for that kind of change, how do you recommend we advocate for moving away from the contract role and the subcontractor kind of situation and moving to being direct hires in this sea of change that we're in?
Again, it goes back to money. So if you look at usually, again, in Missouri, when I've looked at subcontractor rates, it's per hour, and it's usually costing the districts more, maybe right at, if not way more than if they did a direct district hire. And then with that direct district hire, that person could be, sitting on committees, they could be working on policy, they could be giving back so much more to the school district than what they do as a subcontractor. So it's more fiscally responsible for a lot of districts to not do the subcontractor because it's more expensive and have the direct hire, and they're on contract, and then they have a more reliable, they're going to be here next year, whatever it is. It's just a more stable for everybody. And so I think it's, finding that common language. Let's talk about the money.
And it's interesting that you bring that up because I had a similar situation. It was for a preschool for, special needs preschool, and they had contracted therapy services that would come in. And I started having those conversations with the director. And, she kind of was saying, I've always wanted to do that, but there is no way we can afford that. We're a nonprofit. We have no funding, And, for early intervention, the funding is even worse from Department of Education than what did you say, 12 to 15% or something?
The earlier,
12 to 18. Yes, 12 to 18.
So fun fact, the federal department has not increased funding for pre-K, but we are seeing triple the number of pre-K students than what we did when they initially started the funding. So just anyway, fun fact.
Yes. And they were well aware of that. And this was 10 years ago. And again, I really had no place. I didn't work for them kind of coming over, but you do have a place because you're just having the conversation, hey, have you ever thought about this? What's holding you back kind of a thing. And, fast forward to 2 or 3 years later, and they had in-house services, and they still do. And then if a nonprofit can do it, but again, it comes down to the perception is often that it costs a lot more than what they are paying per hour. But when they actually do the math, it doesn't really work out to be. And there's so many benefits to having the in-house that I think you could put that argument in there as well.
Yes, absolutely. It goes back to the allies and the team and the collaboration.
Yeah. And that continuity of care.
Yes.
So let's go ahead and see if we have any more questions. So I did want to give a quick shout out because I see people are putting where they're from, and you have a neighbor here in Kansas, which is really cool. We have some folks from New York, and I have a neighbor in Florida, a couple of people from Florida. So another one from Kansas. So this is really exciting to see that we have people from all over. I have another question for you. Now that we've been talking a little bit about thinking big, I guess is probably the way what we could call it. What are like 3 big takeaways, actionable takeaways that we could do for school-based practice that really line up with this activism perspective that you put out there? What could we do if, let's say next week Monday, I go back to school and I'm like, okay, I had some time to think about it. I've talked to some of my coworkers and we have a plan.
Right. So first, number one, I'm going to go back to the importance of building those relationships. I just cannot emphasize the importance of this enough. And it changes your whole perspective on the job when you have a solid alliance with the educators that you're working with. So build relationships with them, build relationships with the other related services providers, hold each other up, encourage each other to ask questions, to push back, because it's scary. If you feel like you're the only one and you're kind of swimming against the current because we've just kind of always done it this way. That's I hate that phrase, by the way. We've always done it this way. I usually have to cover my mouth because I don't care. And we need to do it differently. And when all these changes are happening, we can't continue to do things the same way. That's the whole point. So build those alliances, hold each other up, push in. Again, I don't like that phrase. Work in the natural educational context with the students as much as you can. And that's going to help build those relationships and those connections. Second is, again, diving into that whole MTSS process. Every district is working on building that team and that framework. And my experience with this is that no district has really included OT in that process, or PT, maybe SLP here and there, in what that's going to look like. And we can't be an afterthought. We can't afford to be an afterthought in any of this. So we need to be, again, we hear the announcement on the intercom. We need to invite ourselves to those meetings. We're not going to kick you out. And we're not going to say, no, you can't be here. It's this only club. No related services allowed. Just invite yourself when you hear about the meeting, or ask the administrator, hey, what does a framework look like for this building? Can I be at the next meeting? I did that with one principal. And I said, hey, can I go to that meeting? And she goes, sure, whatever. And afterwards, she was like, I wish we had done this 6 months ago. I was, yeah, me too. I wish I would have asked 6 months ago, but I was nervous because I was told this is how we've always done it, or this is how we are doing it, or don't ask right now because we're at the very beginning. We need to be at the beginning. We need to be at the beginning of the processes. And if we're not there at the beginning, we need to get there now. So when you go back to work, find out the team, whatever the name of the team is, and invite yourself to the meetings, or ask, hey, can I be included in this meeting to see what the OT role could be and how I could support you and benefit the student, whatever that looks like. So that's number 2. And then the third one is, it's really important. We've talked about advocacy and activism, and I recognize that not everybody wants to speak to policymakers or wants to talk to administrators about, we really should be doing it this way. That's really uncomfortable for them. So a way you can impact change is by being a paid member of your state professional association and your national association. And the reason is because both of those levels pay for lobbyists to talk policy, to go to those legislators, to push back on our behalf. And they will invite you to testify or provide testimony if you want to, if you're working a bill or you're pushing back against something, but you don't have to. But your money as a member helps support, to pay for those lobbyists, and they are not cheap. And so again, with these changes happening, we have to have somebody at the state level and at the federal level, because we need to be working with the federal Department of Education. And then as those decisions maybe get trickle down and transfer to the department of your state Department of Education, we need to be in those discussions, and our lobbyist needs to be there identifying the people we need to be talking to. So if you don't feel like being an advocate or an activist, that's fine. Then just be a paying member of your state and national association. It's super important.
And maybe you don't feel like being that person, again, like I said, but maybe you see someone else who would be good, and you can partner with that person and be their proxy, for research, or, supporting them, or being their biggest cheerleader. We all do better when we have support. And some people like to do things more informally, and that's fine. But you can be a help.
There's all kinds of different efforts, right? So I'm speaking for occupational therapists. We tend to be kind of a creative artsy group. So when you're thinking about lobbying and legislation, you always leave something behind, right? And so somebody has to create the visuals. Somebody has to create the handout. Somebody has to create the cute little note cards that you leave behind with the legislators. Maybe you love to work in Canva. That would be great. I don't want to have a conversation, but I'm a master at Canva, and this is what I want to, work on, and done. And so there's so many different ways to be involved in that effort without being the one providing the public testimony or having the direct interaction or conversation with the legislator.
Yeah. And I think another question kind of to think about here for you, because I know you've been doing this for a while, and you've been working at that activism level with these bigger contexts, like, the policy level and things like that. Do you have some good stories? Because I think, first of all, OTs are really good at telling stories. We love to do that. But I think it's important for people to hear some examples of people that out there who are doing it. Because I know whenever I hear this, I'm like, okay, I guess I could do it, and I tend to be somebody who does jump in. And even sometimes you have a little pause when maybe it's a new situation or something you feel like maybe this is a big step for me. But then when I hear somebody tell a story about someone who did something that you don't think one person's capable of moving the needle at that level, I think that can be really inspiring. And I know you probably have some good ones. So do you have any inspirational stories for us that could kind of help us think about putting this into action?
Sure, I'll try. So I think, and again, this goes back to the importance of building those relationships and recognizing that the first time you jump into any kind of advocacy or activism, it's okay to be nervous. You kind of get like an adrenaline dump and you might be a little shaky. That's okay. That's normal. And have felt that way at times before too, even though I've done this a lot. But building those relationships and remembering that the people who are in office, even though they may not act like it sometimes, they're still human. And so I created and have helped maintain a Missouri Hill Day in our state capital every year. And so I help students and other practitioners come through. And I cannot tell you how many times I have told them, just go have a conversation because you are going to have somebody in common that you know. And I've had so many people come back and go, oh my gosh, he is my best friend's neighbor. I had no idea. And then as soon as they kind of got that out, then it was just like this chat. And then he remembered who we were and why we were there. And it was more important because they made that personal connection. One of my very earliest interactions, I think I was an undergrad actually, and I went to the Capitol, and my old elementary school principal at that time was a state representative. Now, I hadn't seen this man in over 20 years. And I went knocking on his door and they let me go in. And he not only remembered me, but he remembered my parents' names, my sister's names. Now that's kudos to him because that's a lot of information in his brain. But then I kind of was like, okay, these are real people that I know. And years later, I was working on Medicaid reform because, that's an easy project, right? But I went knocking on somebody's door because he was the chair of a Medicaid reform committee. And we started talking and found out that he didn't live in the small hometown where I grew up, but he taught in the school where my same principal was. And so like him and my second grade teacher used to bus kids, bring them on the train to the state capitol every year. And so we knew all these people because he'd worked with all of my elementary school teachers. And it was just amazing. And then he was able to say, we're going to get you a meeting with this person, this person, this person. And we got to talk about Medicaid reform. And so it's just, biting the bullet, sitting down, realizing that they're real people, finding the commonalities, building the alliance, and having the conversation.
Well, you bring up something interesting because you just brought up the parents. So we haven't really brought them up tonight. And, and I'm wondering if there is something to be said about how we can include them as interest holders in all of this as well. How do you see that being part of this activism?
Well, that's a whole other side to the coin. But it is very important. And I mean, if we work in school-based practice, I'm sure people have seen parents who are frustrated with the services or with the plan or have questions or concerns. So I want to be clear that it's not great to be an activist as a school-based OT with a parent who's upset with your school. Just want to make that clear. So I never, there's that line. So I could never be my activist, Jackie, in an IEP meeting. Not a good idea. So don't do that. But in other capacities, you can. So like I said, I'd have people contacting me on Facebook, or once I left a certain school district, or somebody reached out to me, or I did early intervention in Missouri, and I had parents who would call me 4 years after I had discharged their child because they turned 3 and they were getting their first IEP, and they're like, oh my gosh, help me, kind of thing. Mm-hmm. So it's important to ask parents what they are concerned about and how you can support them, because then you can get the parents to support you. And so just another example, years ago, it was a big election year, and I decided that I thought it was really important that we invited the candidates for a healthcare forum that included occupational therapists, physical therapists, and speech language pathologists. Reserved a room at the Mexican restaurant, invited all the candidates, everybody but one of them came. And we had a packed room. We had like over 90 therapists show up, and we only talked about healthcare and therapies and insurance and Medicaid. I mean, it was amazing. And I'd had a mother contact me, and she said, I'm not a therapist, but I'm a mother of a child with a disability. Can I come to your meeting? And I was like, well, of course. Mm-hmm. And her and I, a couple weeks later, met at a Burger King play place. with our kids. So we kept the kids busy with the play place, right? They're climbing up in the tubes. Set up a table, and we said, we need to do something about insurance covering therapies. As a mother, my child needs these therapies and my insurance company won't pay for it. I'm the occupational therapist. I want to provide those services to your child and I can't get paid for it. And so we just created our own little thing, and we created a Missouri Disability Empowerment, or MODE. And it is still active today. I'm no longer actively engaged in it, and she's actually a paid advocate for a different group now, but it is still up and running. And they are focused, it's a group of parents, and they are focused every year on education reform and legislation. And they are deeply involved in education, legislation, and policies. They are at the walk in the Capitol. Everybody takes their kids, and the legislatures know that because we walk the halls with our kids. And so now they see these parents, they just keep coming. They just keep coming. And so sometimes it's helping parents find their voice and showing them how to organize to take back a little bit of power and say, I can voice my concerns, and I have other experts in the field who are telling me that this is okay for me to say that. Because I think sometimes they're worried about that professional line. I'm not a professional. I don't have those skills. Give them permission.
Yeah. Right. That's a great, I love hearing about that. And I remember MODE and how important that was too, that you included education for the parents to really understand the special education laws and everything associated with the services that their kids were receiving. Because that's another big part of this. I think as OTs, we need to be very clear and understand as much as we can about this system that's different than the healthcare system, and then also help the consumers understand that system as well. It's not so easy to do, right? You have some feedback here in the chat. I noticed there's some folks who are saying that it's, agreeing with you about the national and state OT associations, very important to join. And somebody even added that Hill Day is a great experience for OT students. I would say it's also a great experience for OTs and OTAs to go. I love going at the state and the national level. I think is really, really important. So on that note, I wanted to check and see if there's any more questions before I go to the next question here. So we've talked about some of the examples here, and I know we have a very special guest that is going to be coming on after this. Do you want to give a little bit of an introduction so that everybody in the audience knows the second part of this that we're going to be conducting tonight?
Yes. Let me text him to tell him to head over here. So, you guys are going to be hearing from my son, Zachary. He's 22, and he was diagnosed with autism when he was 9. And he does a very good job of articulating things that I never could regarding his experience with autism. And so, and he struggled in school. So we thought it would be kind of cool to hear from an adult who can reflect a little bit on his experiences as a child with autism, and he's willing to talk about it. So yeah, close the door so the cat doesn't get in. All right, so he's going to switch places with me.
Okay, so Jackie, before you switch over, oh, we got Zach. Here he's coming.
It's okay.
Yes. Oh, he's coming. So with Zach, I'm gonna just let the audience know when Zach comes on that they're going to give us some questions or some questions that we can answer. But I'm going to have you come back in and do one last question when he's done to wrap things up. So hopefully everyone will start putting some questions for Zach into the question and answer box. And Zach, sorry about that, Jackie. Zach, you're on.
Right. Hello.
Okay,
Hi, Zach. How are you? I'm Nicole. It's nice to meet you.
Nice to meet you too.
So I have an audience here that's going to have some questions for you. But before that, I wanted you to just go ahead and introduce yourself, if you don't mind.
All right, sure. My name is Zachary Sample. I just go by Zach. I managed to get my Eagle Scout very luckily, along with my my high school stuff done. The high school stuff I'd say was difficult, but not as difficult as scouting to a degree. What else would you like me to talk about?
Well, could you tell us a little bit about school for you? You said it was difficult. What were the things about school that were difficult for you?
So I was in public schools for a good till seventh grade-ish, I want to say. And it went fine for the most part for sixth grade. But when I hit seventh grade, for whatever reason, my brain and body weren't like in sync, I guess. I guess that was because I was a teenager or whatever. But I was in their special education classes, and they didn't go as well. Is mainly because I feel like they didn't have the funding to really like make sure I was in class or make sure I was actually participating in group events and all this other stuff. So I mean, looking back at it now, I kind of feel bad for them because I was kind of a not really a nuisance, but kind of a outlier, I guess, or someone who just didn't want to do anything, I guess, at the same time.
Well, so hearing that, and I don't think you're alone because yeah, you're talking about middle school, right? Everybody in middle school is kind of going through the brain and body connection changes. So my question would be, looking back on that now, what do you think could have been helpful for you?
Just have someone just pop in and say, "Hey, is he here or not?" would probably be good. Um, what else would I want to say for that? I mean, that's really the big one. Make sure I'm actually in the class. Make sure I'm actually doing something. I mean, there were some times that they were in the classroom, but they weren't really. They were just there to make sure nothing went wrong, I guess.
Mhm. Did you feel like you wanted someone to have like a relationship with you and like really care that you're there and succeeding?
Yeah,
Is that
I
something
really
you
do
felt?
think that would be something that'd be helpful. Sorry to interrupt, but that's something that I think would be helpful. I mean, I've had whenever I stopped going to public schools and did homeschooling for a while, I did have a teacher who wasn't really that good. I'm not even going into too much detail on that right now, but just having someone there that actually wants me to succeed and actually wants me to pass school tests or whatnot, I think would have been very helpful. Yeah.
Mhm. So you did you end up going to private school after that, or you were homeschooled?
I was homeschooled after seventh grade and all the way through high school.
Okay. And so did you have occupational therapy services during that
Um,
time?
no, not during that time.
No. Did you have speech language services?
Yes.
Okay. So can you tell me a little bit and tell the audience as well, what were some of the things that they worked on that you think were helpful for you?
Um,
You remember?
I don't really remember much of
Remember?
the occupational stuff.
No.
I was not very old, I'm guessing. So,
Mhm. If you were to go back into the school now and talk to some of the kids there, what would be some of the advice that you would have for the kids and also for the therapists that are there working with the kids now
well, I'm sorry, go on.
now that you're an adult? Yeah.
Okay, so I would say mainly the biggest thing is just keep sticking to it and just make sure you're doing the best you can. I mean, some days you won't be 100%, some days you will, but you just gotta push through it and keep going through it one step at a time. That's what I would say to my past self personally. That's
Mm-hmm.
what. As for the therapist and not the school counselor and stuff like that, just kind of same thing, really. Just
Mm-hmm.
kind of take it one step at a time, one conversation at a time, and just go from there.
Mm-hmm. So I don't know if you know that there's like a lot of changes going on right now with how they're going to do like special education services and things like that. When you hear that, what does that make you? How does that make you feel as somebody who received those services and for other kids that have a diagnosis of autism? How does that make you feel?
I mean, it depends on the change. If it's a positive change, like a little more funding for people that need that help, then that's good. But if it's like, oh, we're gonna cut off a bunch of stuff that you used to have, then that's possibly going to be an issue. I would think
Mhm.
it'd be an issue because autism is such an interesting thing from a third point of view because it can differ so much between people. And people who need that little bit of extra help, if they don't have that extra help, then that's going to be a little bit difficult, I would say.
Yeah. So do you ever help your mom with some of her activism and advocacy work?
I want to say
Into the Capitol.
I went to the Capitol a couple times with her, yes.
What did you
But
think about that experience?
it was an interesting experience. I mean, it's not every day to go to the Capitol, Missouri, so it's very interesting to see what all is going on in the state.
Mhm. Did you get to meet with any of the legislators there?
I believe so, yes.
They were my governors.
I was there when the governor signed the bill, apparently. I don't remember much of that, but
Oh,
I think I remember a little bit of it, but not a whole lot.
yeah. Okay. Okay. So I wanted to see, I'm going to check and see. I don't know if I have any new questions. Let me check and see. Okay. So let's see. Here's a couple questions. So I think these are actually for your mom. I don't think I have any questions for you from the audience in here because I'm not seeing them. And maybe let me just check really quick. Oh, here we go. So yes. So we actually have a couple. So Zach, this is from Megan. She is curious about what your adult life looks like. Do you have a job? Do you participate in post-secondary education? And what are your hobbies? So let's start with, do you have a job?
As of right now, I do not have a job because I have, the main reason is because the requirements most of them have. Like, you have to have a driver's license, you have to have experience, all this other stuff. And I'm like, okay, that's fine, but the main issue I'm having the issue is with needing experience because these places don't want to train people, especially people who have disabilities to an extent. They don't want to train them, and I'm like, that's unfortunate. The second reason is because I personally have a fear over driving to an extent. So finding a transportation, a reliable transportation, is a little bit more difficult than I'd like to think about, honestly.
So do you participate in post-secondary education? So have you done any school post-secondary education once you graduated?
No, I have not done any thing to further my education. As of right now, anyway, I have not, no.
Okay. And what are your hobbies?
Um, Indoor hobbies, I do a lot of games on the computer, and outdoor hobbies, I like to go fishing a lot. So those are my two bigger hobbies that I like to do a lot. I'm trying to think of other hobbies that I do once in a while. I do cross stitching, crocheting here and there,
Oh, cool.
and that I can't really think of any other hobbies that I do that are on a regular basis.
So in terms of like looking for a job, what are some things that you think would be helpful for you in the situation that you're in now where you're like, okay, it's hard to find a way to get there because I don't drive and I'm trying to take some of the things that my skills and put them into a job. What are things that you think that would be helpful that you really haven't been able to do to get to having a job?
Well, the main thing is training because I want to do the job and I want to do right, like for the most part, right. I mean, that would be perfect, but just having these companies say, okay, we'll give you like a week worth of training or however much training required for everyone else. Like I've seen some, I don't want to say seen posts, but heard some that some of these places like don't like hiring people with disabilities because they don't. Well, then it's not like they don't like it. It's more or less that they don't give them the equal chance to someone who's more high functioning, I guess is the right word.
So you'd like some more training. Anything else other than just some more training?
Just equality mainly is the other thing. Like, I mean, there's some that are a bit different. I mean, like I can understand like saying, okay, you're in a wheelchair and you can't talk that easily. I can understand that, but the more mental side of it, it really makes no sense to me why you can't be treated the same as if you have a little bit of disability or not.
So if let's say that we had a magic genie lamp, I always ask this question for people. and you got the 3 wishes, what would your 3 wishes be?
That's a good question. Um, Honestly, I'm unsure. The first one would be like just equality overall, like just equality across the board for everyone, not just for jobs, but for like racism and stuff like that. I prefer to treat people the way you want to be treated. That's the main thing I do. As for second wish, I really don't know that. I just want peace across the world because like I'm tired of all the wars, all the hearing all these bad stories on the news every night. It gets a bit annoying and quite concerning recently because of all the stuff going on. As for the third, um, I genuinely can't think of a third wish as of right
Do you
now.
have a third one that would be for Zach? It would be for you?
Honestly, I mean, I would say kind of help me with my mental stuff, but keep me out of my negative loop that I happen to have all the time. That'd be the one I'd do for me personally, but
Mhm.
yeah.
Okay. Those are good wishes. Yeah, I think that a lot of people could definitely relate to the first 2 that you said. That we would all like to have a little more peace in the world and more equality. So those are good wishes. Thank you, Zach. Did you have any questions for me, for the
Um,
audience?
Not really. I do have some stuff over here that I did not see a second until a second ago. I was reading it off to the side.
Oh,
Um,
that's okay.
so do you mean to do these here?
Only if she wants you to. It
Oh,
was just suggestions for her.
oh, those suggestions. Oh, okay, I didn't know.
Okay.
Uh,
It's a bit if you don't mind. So you can want.
Hold on, I'm trying to read this real quick. So one of the things was like, can you talk a little bit about what autism means to you? I think it means a piece of me, not my whole identity per se. Like, yeah, I have autism, so it's not going to define me as a person. So that's why I say to that question specifically. Um, the next one is I remember how old I was when I was first diagnosed with it. I want to say 9, maybe 10, somewhere in that range. 9. Um,
Mhm.
I remember distinctively, like, I don't know why, but like the old, like documentaries and old movies or whatever, I would like nature documentaries about the human body. I always had that one scene stuck in my mind of like the human nervous system of like in black and not black and white, red and blue. I don't remember what documentary it's from. I remember that vividly, and then I always get stuck on like my brain say something here is different. And then when I learned I had autism, I'm like, that was the missing piece, and I never had that thought again.
Hmm.
It made me feel a bit like more reassured in a way. Like I knew that something was different about me, and I finally figured it out, and I was like, okay, now that makes sense.
Right. Right. That's helpful sometimes to have an answer for questions that you have,
Hmm.
right? So, on that note, I think I do have a couple questions for your mom.
Okay.
Okay. Well, thank you, Zach. We really appreciate it.
Alrighty, no problem.
It was nice to meet you.
Nice to meet you too.
Okay. So we actually have a few more questions. So I wanted to grab you while we had a couple more minutes. So a question that we have is how do we encourage the move toward OT services in the classroom when pulling students out has been the classic format? Have you seen pushback to your presence in the actual classroom?
So yes. And sometimes you have to live by the phrase of ask for forgiveness, not permission, but it also depends on your team. So some strategies that I have tried is talking with the educators who have whatever student we're talking about, and saying, hey, I would really like to start to be in a classroom, and having this conversation before the IEP meeting. That way it's not information, and start there and say, and kind of easing into it, because theoretically we're able to change the education plan at any time, right? Theoretically. Nobody likes to do that, but we can. And so for teachers who are more hesitant for that, I would say, let's just do one time a month that I'm in the classroom, and in the other 3, we can do other areas, other spaces. And they'd be like, oh, okay. And I tried that with one teacher, with a first grader that I worked with. And the first day I was in the classroom, she goes, can we do this every week? And change the plan, because she was like, oh my gosh. And the question I always ask is, what is the hardest time of day for your student? And that's when I show up. And again, scheduling's hard, but if you ask the teacher, what's the most difficult time of day, and then you plan your services there, you are really helping that teacher out.
You're an asset.
And that gets buy-in every time. And so they may be timid, but I don't think I've ever had anybody who initially pushed back that wasn't grateful that we moved in that direction after they experienced it.
You know, a lot of times there's a perception. I always say that teachers have a very different goal or concern than we do. We typically have one-on-one. They have a whole classroom that can get out of control. So their concern is always getting out of control. And they imagine things are going to go out of control. And when they realize it won't, then they're happy, right? So just always remember that piece of the puzzle. I learned that, and it made a big difference. So yeah, I think that's that relationship piece you said as well. And also we were talking about the whole, you know, going from contract, subcontract to district employee. And it's been brought up that I think one of the problems is that there's the pensions and benefits. So that adds to the cost, of course. But then another great point is speech therapists have often been classified as teachers. So they get treated completely different. They get that seat at the table, and they can be part of the teachers union. According to, I don't know if that's depending on a state designation.
It depends on the district, because I know Missouri, you know, it's very different from.
Yeah, it's different here too.
Like specifically like union membership. The credentialing as an educator is specific by state. There's only 3 or 4 states in the country that actually allow occupational therapy practitioners to sit for a credentialing exam that would allow them to be a director of something. So that's the movement that's happening, is to create more clear and easy pathways for occupational therapy practitioners to serve in those capacities. Like the last school district I was in, the administrator, the director of special education, approached me about applying. They had created a new position for a person to be over all of the 504s in the district. And she wanted me to apply. And I went to fill out the application, and it asked, well, when did you pass your praxis? And what's your certification through the state? And I'm like, I'm not. And so they wouldn't accept my application, wouldn't even consider it. And so then I took a leap, and I'm like, I'm just going to apply to be able to take the exam that would allow me to be an administrator. And they wouldn't even let me, like, they rejected my application. And so that's where that disconnect is happening. So we have these, like, 504 coordinator. Oh my gosh, absolutely something that is so up my alley, and then other occupational therapy practitioners' alley. And instead they hired, an educator who'd been in the classroom, who had to learn what 504s were and what it meant and what the law says. And, so the learning curve was so much more steep. But that's
maybe we should look into how speech kind of found that path, and maybe we could replicate some of that, because that was really smart of them to do that. So here is a really excellent question. What advice do you have for OTAs who want to become stronger advocates, but feel their voices aren't always heard?
Yeah, that's a great question. The first thing that came to my mind as an OTR is, what's your OTR doing? And have you had that conversation? But that being said, there is zero reason. There should be no difference in the voice impact between an OTR and an OTA. You are still a person, you are professional, you are trained, you are skilled in that area, and your voice should provide as much impact as your supervisor's voice, because you are a member of that team. So I'm going to go back to relationships, right? Developing those relationships, those alliances, those camaraderies. It's just so important. And so it's again, you might be nervous. Ask the first question, and don't be directive. But just say, hey, I was wondering, can you help me with something? And then that can be a start to a beautiful conversation that allows more power to your voice.
Yeah. And like I said, nerves just mean that you care. That's all it means. So that's a good thing. And adrenaline can help you out. So we're pretty much out of time, but I have one quick question. I just want to let everybody know there's tons of questions out there. We will get them answered to you when this episode is released. You'll have access to all that information. But really quickly, one last thought. What do you think is the next frontier in school-based practice, and how can we be future thinking to advance practice within special education, no matter how it ends up in public schools?
We have to be at the table. We have to figure out how to get at the table. We have to be part of the plan, not part of the reaction. In whatever way that means to you, that's what you need to do.
Crash the party.
That's right.
I love it. Okay, Jacque, thank you so much. That's all the time that we have for today. Thanks again to Dr. Jacque Sample for the insight and clinical takeaways. And thank you to Jacque Sample for all his wonderful insights related to school-based advocacy. Thank you, everybody.
Thank you for tuning in to this episode of Pediatric Pioneers by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and complete the quiz for this episode. Pediatric Pioneers also listens to you. If there's a particular practitioner that you'd like to hear from, or if you have a question or challenge that you'd like to explore on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com.